Hello, my name is Dr. Alan Stalgis, and I'm the Director of Sleep Medicine Services for Nevada Heart and Vascular Center. Sleep disorders are often associated with the conditions which all cardiologists commonly treat. Diagnoses are as diverse as atrial fibrillation, congestive heart failure, difficult to control blood pressure, among many others. Recognition and treatment of the underlying sleep disorder may be critical to optimal therapy. Nevada Heart and Vascular Center is one of a handful of practices within the United States which have recognized this connection. We have integrated sleep services into the cardiology practice. There are several unique aspects to our program. First, we are nationally accredited. We have met and exceeded the strict standards of the American Academy of Sleep Medicine. Next, we are a cardiology practice. Although not all of our patients have heart disease, our staff are prepared to manage the most complex clinical situations. Third, we have a unique follow-up program. We ensure that our patients are matched to the most appropriate therapy. Our team follows each patient until the desired outcome is achieved. Finally, we are not just a CPAP clinic. Although CPAP is a useful tool, we do offer backup options. For example, we have pioneered the use of hypoglossal nerve stimulation in the state of Nevada. More about that later. The most common sleep disorder we encounter is sleep apnea. This is a breathing disorder during sleep. It's pretty common, and it's a common treatable cause of daytime fatigue. It also puts significant stress on the heart and cardiovascular system and can lead to significant complications. For these reasons, it is important that anyone with sleep apnea be properly diagnosed and treated. Sleep apnea is caused by obstruction in the upper airway, usually at the back of the throat. The airway may collapse repeatedly during sleep. Consequently, the patient is not moving enough air in and out of the lungs. The oxygen level drops in the blood, which arouses the brain just enough to clear the airway, but not necessarily enough to awaken the patient. These events recur repeatedly through the night, interfering with sleep quality. The patient awakens, feeling unrefreshed, and is tired or sleepy during the day. It's important to remember that there are many potential causes of fatigue, but not all are treatable. Fatigue related to sleep apnea is correctable. There are other clues that daytime fatigue may be due to sleep apnea. Patients frequently snore and may have noisy breathing during the night. Restless sleep with frequent interruptions is common. Patients may complain of palpitations or repeated trips to the bathroom during the night. More severe symptoms may include gasping for air, night sweats, or even dreams about suffocating or drowning. Many patients awaken with a dry mouth or headache. The diagnosis of sleep apnea begins with a sleep study. Typically, the patient spends the night in the sleep lab, although home studies are available in certain circumstances. Our sleep beds are designed to be conducive to sleep. The rooms are cool, comfortable, and private. You can even bring your own pillow. If the sleep study confirms sleep apnea, we will discuss treatment options. The goal of therapy is to improve sleep quality and improve daytime symptoms. Effective therapy may also reduce cardiovascular complications of untreated sleep apnea. CPAP is a good place to start. It has a very simple principle. We're adding extra air pressure to the airway to keep it from collapsing. It does not breathe for you, but it keeps the airway open so you may continue to breathe as you should. CPAP is very effective, by which I mean it completely eliminates sleep apnea. CPAP does take a bit of getting used to, and most patients do fuss with it on first starting. You are not alone. We do have a team of trained professionals who can troubleshoot for you. About 80% of patients do extremely well with CPAP. By this I mean that they are able to sleep through the night, awaken feeling refreshed, and have good daytime energy. About 20% of people do not get a good result from CPAP for whatever reason. And we do offer several backup options. Which option is best for you depends on the type and severity of your sleep apnea. An oral appliance is a good solution for people with mild to moderately severe obstructive sleep apnea. This is a mouthpiece that can be molded by a qualified dentist or orthodontist. The appliance pulls the lower jaw forward. This pulls the back of the tongue out of the airway. Patients with moderate to severe sleep apnea who have failed on CPAP may benefit from surgery. We recommend the Inspire system as the best surgical option currently. In the past, there were a variety of surgical procedures designed to enlarge the airway. These operations involved a difficult recovery and frankly were often not very effective. The Inspire system does not operate on the airway. Instead, it involves an implant below the right shoulder. The implant looks a lot like a pacemaker. In fact, the technology was developed by a pacemaker company. However, instead of stimulating the heart, we stimulate a nerve below the jaw. This moves the back of the tongue out of the airway while the patient breathes in. As the patient breathes out, the tongue relaxes. The patient turns the device on when going to bed and turns it off when getting up in the morning. Recovery from the surgery is not prolonged, and long-term results have been very good. Other sleep conditions that we commonly treat include central or complex sleep apnea, periodic limb movements, sleep, or narcolepsy. In summary, we recognize that sleep disorders are common and are commonly associated with cardiovascular complications. Effective therapy requires a team approach utilizing different tools, including CPAP, oral appliances, or surgery when necessary. And remember, life is better after a good night's sleep.